Hello, welcome to my channel. Today I wanted to vlog about the two options that were given to me for the clear cell cervical cancer. If you're new to my channel, yes, I'm 21 years old and I'm from Florida and I have clear cell cervical cancer. And I want to talk about the two options that were given to me. So I'm going to get straight into the video. The first option that was offered was chemo with radiation and then chemo with surgery. So because the clear cell cervical cancer is so rare, and especially in someone as young as me, they chose surgery and chemo as an option. The surgery and chemo is experimental because there's not a lot of research done on the kind of cancer I have, and there's not a lot of information. The standard treatment is usually radiation and chemo, but because I'm young and I've never had any children before, and I kind of wanted the option to have children later, I chose the chemo, and I wanted like for sure to know and have peace of mind that the cancer is gone. So I personally chose chemo with surgery. I spoke to my radiologist, and what she said to me was that because the cancer is so rare, she's not really sure how the cancer will react to the radiation. She doesn't know because the kind of cancer I have is very aggressive. She didn't really want to take any chances. But she was pretty honest. She was saying, we don't know how well it's going to take to radiation. And she herself was kind of like, gearing more towards the surgery. Now, what scared me was that my doctor, what she suggested was that I get a hysterectomy, which honestly I didn't even understand it because I have stage 1B2 cervical cancer, so I didn't understand why I needed a hysterectomy. And a hysterectomy is pretty much when they remove your ovary and your uterus and the cervix too. And my cancer is only on the cervix, so I didn't really want a hysterectomy. Yeah, I didn't really want that, but what was told to me was that we're gonna see how small the chemo will shrink the cancer, and then that will determine what's removed during surgery. And I have my folder in front of me, and I'm gonna look through the folder and give you guys the information on the medication that's gonna be used for me for the specific kind of cancer I have. So I'm gonna look through the book. Okay, so there were two things. Okay, chemo with radiation and chemo with surgery needed two different kinds of medicine. So if I were to go the chemo with surgery route, I would only have to take one medication, one chemo, and that's called cisplatin. And it's supposed to be an anti-cancer chemotherapy drug, and it's a alkylating agent according to what this says. And a couple of side effects. I'm gonna read some side effects. It causes nausea, vomiting, low blood counts, kidney toxicity. What else does it cause? It sometimes it causes you to have like a blood test abnormalities like magnesium, calcium, and potassium. And it says these are less common side effects occurring in 10 to 29% of the patients receiving this. Okay. And also, it says contact your care provider in 24 hours if you notice nausea, vomiting, diarrhea, no urine output in a 12-hour period, blood in the urine, pain or burning, black or terry stools, unusual bleeding or bruising, swelling, yellowing of the skin or eyes, and mouth sores. And it also just gives, I guess, some tips on what to do. But this cisplatin is spelled CISPLATIN. Okay. So the medication that was offered to the chemo that was offered to me with surgery is two. It's Taxol, spelled TAXOL, and carboplatin. That's spelled Carboplatin. Now, my doctor told me the Taxol is known to make you lose your hair, and as y'all know, I'm 21, okay? Like, I don't want to be losing any hair, okay? But because that's the route I chose, I may be losing some hair. And yeah, that's the I'll be making another video about that later. Y'all gonna see me shave my own hair in another video. But so yeah, for chemo with surgery, those would be the two chemotherapy treatments used. The side effects for Taxol, it says the side effects of Taxol are low blood counts, hair loss, nausea, diarrhea, mouth sores, hypersensitivity. Now, this is a disclaimer, guys. Just because I'm reading these off to you does not mean that you will have these side effects, okay? My doctor said that when these are tested, if anyone experiences anything, they have to put it down as a side effect. Even if, like, they tested 100 people and one person got nausea, they have to put that, okay, this causes nausea. Okay, so don't freak out. This is just, I'm just reading what's on the what's in my little pamphlet that they gave me. This right here. Okay, so don't freak out. It also causes, Taxol also causes hypersensitivity, swelling of the feet, etc., blah blah blah. It can also cause bleeding in your bowels and urine. Okay. And then the next one, carboplatin. Carboplatin also can cause hair loss, weakness, blood test abnormalities, burning sensation at the injection site, diarrhea, constipation, infection. There's a chance of infection. And yeah. Yep. So I'll be receiving both the Taxol and the carboplatin because I want the surgery option. If there's any questions you have for me, you can please comment, like, and subscribe. I will be open to answering any questions that you may have. I just chose surgery because honestly, like, I want this to be over with. Like, I don't want to have to go through this again. I just feel like it's more guaranteed if you get surgery because they're actually going in there and cutting it out and removing it. I'm super happy that they caught it early, and that it didn't spread because that would have caused more issues. But I'm really happy that this is an option now because, like I said, this cancer is so rare. The surgery with chemo is experimental, okay? So they're not sure how this cancer is gonna, because I have clear cell cervical cancer, they're not sure how it's gonna react to treatment. So I'm taking a little bit of a chance, but obviously, like, chemo is known to shrink tumors and cancers, and so it should work. But fingers crossed, okay? And yeah, I think that's it. Honestly, I really didn't even want to share this video because I just felt like it was super personal, especially because of where it is, it's on my cervix, so it's kind of awkward to talk about, but I figured if it will help someone, which I hope my video does help someone, then it's worth it, but honestly, like, I'm just gonna be honest with you. Like, when I first got my diagnosis, I wasn't really scared, but now it's like I'm a little scared and I'm a little worried because it's like we're getting closer and closer and closer to the treatment. My first treatment is actually tomorrow. That'll be a separate video. And I'm just here to encourage you guys, like, if you happen to be out there and you get diagnosed with something as scary as cancer, I just want you to know that it's okay. Things will be all right. You're in the best hands and the best care with the best medical team. I just want to let you guys know, don't be scared. Don't be worried. It's okay. Like, I'm here. Like, if you want to comment or if you want to talk to me, I'm available. Just leave a comment down below and I'll comment and message you. Like, it's okay. Like, be brave, be strong. This is no time to cry. Like, you will get through this and everything will work out in the end. And that's what I wanted to say about that. And also, this is a wig I made. I know I look a mess because I just came from like a little family dinner, and so I hadn't you know taken my wig off or prepared for the night yet because I want to film this, but I just want to let you know, like, it's okay. It's okay. Everything will be all right. Don't be sad. It's not a time to be sad, and it's not a time to cry. It's time to be strong, and you will get through this. And yeah, so thank you for looking at my video, and see you guys later. Bye.